Next panel is Sarah Slayman, Gary Oldham, Pat Leon, Sarita Smith, Pamela Oldham. They will be followed by Nancy Stewart, Penny Leone, Chris Green, Clara Wellner, Martha Molinsky, D.T. Ray Allen. Sarah Slayman.
Thank you, Chair and Committee. My name is Sarah Slayman. I'm a constituent of Senator Whitmire. I'm here to testify against SB1 because I'm tired of Republican primary politics, misogyny, and greed dominating the state I was born, raised, and schooled in. And, you know, I had some really eloquent remarks written out, but you guys have just worn me down all day with all this terrible science and glad-handing. And to be frank, I get to move to New York next month, so I don't have to live in fear of you Texas legislators anymore and what you're going to do to my education system or my health care system, because I'm going to a state that doesn't kill its own inmates. That's how pro-life it is up there. I will thank you, though, first. It was destiny that you would discriminate against us and try to force your way inside the bodies of Texas women. Thank you for finally working against us women so publicly and not in the shadows like you're used to. Thank you for every single bad press conference with your bad information. Thank you for every hateful statement degrading women and girls to sex objects and broodmares and bald eagles and leather wallets like your eloquent pro-life supporters have done today. Thank you for being you, Texas legislature. You have radicalized hundreds of thousands of us. And no matter what you do for the next 22 days, women and their allies are coming for you. Let's start down the line. Senator Campbell, you're an ophthalmologist, so I won't be making you the expert on reproductive health. We can give you all the children with chlamydia and herpes in their eyes since we don't have sex ed in this state. And Senator Hagar, you're about as helpful. You are about as, excuse me, this is my government, ma'am. I will judge you. I will judge you, ma'am. Is this counting against my time?
Yes, it is.
The senator talking against me?
Yes, it is.
Okay. Well, I will just go ahead and talk over her. And this is how big of a fraud I knew you were for being so proud of these proceedings all night. It's a low bar that you hold yourself to, that you simply allowed us to speak. And I will speak against an ophthalmologist who says, everyone on the internet can see what you're doing right now. This is a farce. The Texas legislature is a bunch of liars who hate women. These men
Our
are
next
paid by all
witness
these
is Gary Oldham. Is Gary Oldham here?
Yes, ma'am.
Go ahead.
So that they can tell us what to do with the inside of our bodies.
Go ahead, Mr. Oldham.
Thank you. My name is Gary Oldham. I live in Round Rock, Texas, where I'm represented by Dr. Charles Swertner. I'm here to speak against SB1. If the intent of this bill is to control women, to produce a state of broodmares whose purpose is to feed a baby mill, then ALEC has provided excellent legislation. If it's supposed to be about women's health, it is laughable in its falsity. If it's intended to reduce abortions, it is an abysmal failure. I think we can all agree, orange shirts, blue shirts, Republicans, Democrats, Texans, and even imported witnesses and traveling lawyers, that reducing abortions is an admirable goal. This bill does nothing to reduce abortions, even at the admission of its supposed author. Abortions will happen, and under this bill, many of those abortions will kill women. Let's do something morally sound, something that is non-controversial to any reasonable thinking human. Let's actually reduce abortions. What we're doing today isn't working. Abstinence is simply a means of burying our heads in the sand and pretending teens don't have sex. Texas is third in the nation in teen pregnancies. Texas is first in the nation in repeat teen pregnancies. Let's spend some time and money in real science-based and reality-based sex education. Let's ensure availability of contraceptives. These simple, pro-life steps will do vastly more to reduce abortions than this bill could ever pretend to aspire to. The cost of these unnecessary and arrogant special sessions would have gone a long way to get a real program to reduce abortions kicked off. Do the right thing for the right reason. Vote no on SB1 and actually do something that reduces abortions. Be genuinely pro-life instead of just spouting the phrase self-righteously for political gain. Thank you.
Thank you. Pat Leon. Pat Leon here. Pat Leon was in favor of the bill. We will change that from oral testimony to registering a position in favor. Darlita Smith.
Starita Smith.
Darlita, go ahead.
Yes. Thank you for allowing us to speak on this issue. I am Starita Smith. I have a PhD in sociology. I have studied issues of the work, sociology of work, and also inequality in society for various groups. I live in Denton, which is represented by Craig Estes, and I am representing myself in opposition to SB 1. How is it good public policy to deprive the poor, the working poor, people who live in middle-sized and small towns and rural areas access to free or affordable health care, including abortions? There seems to be no or very sketchy anecdotal evidence that women's health care is being endangered by current providers. You are creating an emergency where none exists. The legislature of this state has declared a war on the poor. Weapons deployed so far include cuts to educational funding, both for lower education, K through 12, and higher education, turning away federal funding, and cutting health care. SB 1 is the newest weapon in this war. Considering how effective your attacks on these particular programs have been so far, who will step up and take care of these people that are going to be deprived of what they need to begin a better life in the state of Texas? I have listened to the stories. Well, I will.
Thank you.
Stop.
Pamela Oldham.
Yes, hello. I can't believe I'm finally, after 3 weeks of being here, actually testifying. My name is Pamela Oldham. I live in Round Rock, Texas, a constituent of Senator Charles Schwertner. And I wanted to compliment you. I've watched you while I was sitting in here, and I see that you are very attentive, and you have looked at every single person who's testified, and I really appreciate that. I oppose SB 1 because its provisions force childbearing, and that endangers the lives of Texas women. Childbearing is inherently dangerous. Maternal mortality in the United States declined over the last century, but this trend has reversed in recent decades. About 650 women in the U.S. die each year from pregnancy-related complications. The rate of complications has doubled in the last decade, and the rate of near misses, complications so severe that a woman nearly dies, has increased by 27%, now affecting about 34,000 women a year. It seems to me that the rise in maternal mortality is no coincidence. Clearly, the relentless and continuing erosion of women's reproductive rights in the U.S. since the 1980s has influenced the alarming rise in pregnancy-related deaths among women. If SB 1 passes, other Texan women, especially the poor and those living in remote areas of the state, might not be as lucky as I was. I developed high blood pressure and preeclampsia after the 20th week of pregnancy. Without access to good prenatal care and the financial wherewithal to follow my doctor's bed rest orders, I probably wouldn't be here today. SB 1 will shut down 37 of 42 community health centers across the state that currently provide affordable reproductive care, routine exams, cancer screenings, and yes, prenatal care. Women who receive no prenatal care are 3 to 4 times more likely to die of pregnancy-related complications than women who do.
Thank you for being here. That's it. Okay, thank you to this panel.